Hello everybody, this is Dr. Jaffrey again. I'm a board certified gerontologist and internist. Today I'd like to speak to you about a very interesting topic that is long COVID. This is a term that's coined after people who've had COVID infections, and 2 to 3 months after you've had COVID infections you're still having symptoms. So it's a post-COVID syndrome. And the main criteria is more than 2 months after the infection, and also the symptoms are not explained by any alternative diagnoses. So most common symptoms are fatigue, dyspnea, which is shortness of breath, cough, chest pain, headache, muscle aches, as well as diarrhea. There are other cognitive or brain-related symptoms that are described, such as difficulty concentrating, insomnia. So the main thing that was found in observational studies is the recovery depends upon the comorbid conditions that you had and your severity of your COVID infection. So if you had diabetes, CHF, COPD before you had COVID, so then you're more likely to have the post-COVID syndrome. Now, just going over the data, there was observational studies, which is 1,600 patients were observed in a study done in the United States, and about 2 months after infection, patients reported 33% reported some kind of symptoms. Most common were about 24% had difficulty with stairs, 17% had shortness of breath, 15% had cough, about 20% had myalgias. Now, these were mostly hospitalized patients, but then looking at outpatient recovery of infections, there was a study done in Denmark, and again 21% reported fatigue, 17% of the patients had some loss of taste, dyspnea was reported about 12% of patients, and intermittent headaches were reported about 10% of patients. Now both these studies are observational studies, and I'll put the evidence in the comments section if there's any other further questions, but this is a phenomena that we will see in an outpatient setting more and more as people recover. There will be some kind of sequelae from infections from COVID-19. Thank you.